Hello everyone, welcome to the Safe Office. I'm going to do a quick little voiceover to what a day in my life looks like here. So let's start off talking about supervision. So supervision here is amazing. I will talk about it in a lot of the other parts of the competencies as well. My supervisor is Melissa, who you'll see in here in a minute. She's amazing. We talked about everything we work on, ways we can improve. I always feel comfortable sharing. I feel comfortable asking questions. We met about every other week or every couple weeks, depending on our schedule. I'm definitely nervous for next year because here at SABE we're a small, close-knit office, and I can ask just about any question at any time. And I feel like at the MICU, at the VA next year, it might be a little different, but I know that's something I could address, and it's super important to advocate for ourselves. I've learned that as a future social worker, I will definitely be that person who advocates and fights for their clients. I know sometimes working with certain organizations, there's limited freedom and not many people who will listen, but I'm determined to be someone who will always try for my clients. And I think that's also one of my strengths, as well as being able to adapt and be flexible. I tend to be a quick learner, I pick up on things, and even if I'm not feeling the most confident in myself, I'm always confident in my skills and my ability to ask. One thing I need to do for sure is practice more self-care. It's so easy to get caught up in full-time classes, homework, regular work. Sometimes you don't focus on your needs, and that's something I'm really going to work on next year as an advanced year student. I also follow the code of ethics pretty much every day. I go into supervision when needed. I make choices depending on those boundaries. I've learned sometimes there are situations you don't want to follow the code of ethics, but they're definitely there for a reason. Now, let's get into the core competencies. I focused on the first three. So let's start with competency one, the identify as a professional social worker. So we do this in a bunch of ways. We definitely advocate for the client's access to services. We engage in supervision, as I discussed before, and we do a lot of reflection. So ways we do these things are we attend tabling on Green Street. We engage monthly with other offices on campus through Zoom meetings, sometimes even in person. I talked about supervision a bunch, but we use this time to debrief and ask questions. And then reflection, we do a lot of reviewing our session notes and even watching ourselves on video. We talk about things we can improve on and things we did well, and we use this feedback to improve our skills for next year. Another super important one is competency two, applying social work ethical principles to guide practice. So we make just about all our decisions using the MSW Code of Ethics. So we use these when determining and assessing whether STIR is the most appropriate intervention for students. We don't use judgment, and we create a comfortable space while also knowing the boundaries and setting those boundaries. We also know when something needs to be brought to supervision. If anything's ever questionable, that's definitely an ethical issue, and that will be brought to supervision. We also apply strategies of ethical reasoning to make decisions. So we ensure confidentiality, we get verbal and written consent through our students, and even have FERPA waivers signed if needed. And lastly, competency three, we apply critical thinking to inform and practice. So we analyze models of assessment, prevention, intervention, and evaluation. That's basically what we do here at STIR. We use the audit QDIT PHQ-9 to prevent evaluations. We refer client to appropriate sources if needed. We build rapport and use motivational interviewing as our brief intervention tailored to the client. We also use effective written and oral communication skills. So as I said, we use supervision. We also keep clear SOAP notes, and we update the Maxient USC system, use Excel and other platforms, and we also send emails to clients when needed. Lastly, some goals for my leadership development in my advanced year is being trusted enough to have my own caseload, even if it's small. I'll continue to use my voice to advocate for my own and my clients' needs, and overall, I would love to get hired out of my advanced year placement. That would be incredible. Establishing goals gives me something to look forward to, even small goals at a time. Like, you hit small goals and it feels so good and continues to motivate you towards your bigger goal. And this is also a technique I frequently use with clients, and it's definitely a motivating factor. Overall, my experience here at SAPE has been incredible. As you can see, a day in my life consists of documenting notes, going through my sessions for the day. Today we got breakfast delivered, which is pretty great. That doesn't really happen often. And we always find time to talk to each other. So popping into the office across the hall and doing anything basically to clear our minds and have a fresh attitude. My experience here has been absolutely incredible, and is definitely making me look forward to becoming a licensed social worker and my experience next year. I will be at the VA in the medical ICU, and I'm super excited, and I'll update you then. Bye.